Good morning, everyone. Welcome to Accessing GAHIN through GAMMIS. I'm Bonnie Young, the DCH Health Information Technology Program Manager. I'd like to welcome you to the Interoperability webinar, Accessing the Georgia Health Information Network through Georgia Medicaid Management Information System, known as GAMMIS. Interoperability is a secure use and exchange of health information. One way Georgia is leading in the interoperability effort is with GAHIN, Clinical Viewer via GAMMIS, which our Medicaid providers can access. Our presenters today are Pamela Matthews and Amin Holmes. Pamela will provide us with the GAHIN overview, and Amin will provide us with a detailed review of the Clinical Viewer. Before we begin the webinar, I'd like to review a few housekeeping tips. This presentation is being recorded. If you have any questions, please submit them via the chat feature or the raise the hand feature. We will unmute the phone lines after the presentation. You might have to press *6 on your phone to unmute the lines. The mission of the Department of Community Health is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. DCH and Georgia Health Information Network, which is known as GAHIN, are partnering for success by working closely to ensure that providers and caregivers can access patient health information at the point of care to optimize outcomes and reduce costs. Accessing the actual Medicaid providers at this time, our authorized Medicaid providers have access to the patient records and reports via Georgia GAHIN Clinical Viewer through GAMMIS. At this time, I would like to welcome Pamela Matthews to provide the overview of GAHIN, the Georgia State Designated Health Information Exchange. Pamela, welcome to the webinar.
Thank you, Bonnie. And we can go to the next slide. And the purpose of, in the next slide, please. And the sole purpose of GAHIN, Georgia Health Information Network, is to create and support a healthier Georgia. And we are doing that through the use and exchange of electronic health information. Next slide, please. And you may ask, well, how do we do that through information technology? We do that, as you can see from this slide, we provide a network of accessibility across the gamut of patient care givers and patient care providers, as well as some of those that have a space in that healthcare continuum that one may not necessarily always think about, such as with pharmacy and the dentist. Next slide. In terms of providing access by all of those who contribute to the care of patient care, we have two products called Georgia Direct and Georgia Connected Care. Next slide. And Georgia Direct, that is our secure email. It is free to providers, and that provides the ability to exchange patient information securely from one provider to the other. And we are very aggressive in terms of deploying this throughout the state across many types of caregivers. And we see that we have a lot of activity through the use of Georgia Direct in the state. Next slide. Our second product is Georgia Connected Care, and that's where the provider can access the GAHIN to actually query a patient and the associated information. And it actually provides a robust data set and really gives a picture of what is happening with that patient across that patient care continuum for those providers who are participating in GAHIN. We have right at 15,000 connected providers, and just to give you an idea, our totals for this year, the providers actually to date have actually queried, which means they've actually accessed and queried a patient, and they've done this over 2 million times. So we do know that GAHIN is actively used to support the patient care delivery in the state of Georgia. Next slide. And this is just to conclude, we have, of course, our membership, and our membership is very broad-based. We have, of course, our state agencies such as the Department of Community Health as well as Public Health, but we have the major healthcare systems around the metro Atlanta area. Then to provide that state coverage, we have regional health information exchanges that you can see here, such as Gracie, Healthy Connection, Healthy Georgia, and then Highbridge, which was formerly Georgia Health Connect. In addition to that, we do have 4 care management organizations who are Medicaid providers, payers, and then we also support specialty connections. Through the use of a national network, eHealth Exchange, we actually have access to federal partners such as the Veterans Health Administration, as well as the surrounding states of Alabama, East Tennessee, South Carolina, and North Carolina. And we are currently onboarding another member right now, and that will provide access for providers in the northwest quadrant of the state. So we're very excited about that. So this gives you a flavor of what Georgia Health Information Network is all about. Next slide. And with that, Bonnie, I think I will turn it back over to you.
Thank you. We appreciate it. The GAMMIS Clinical Viewer is the good news in regards for the actual providers. You have the opportunity to be able to access GAHIN through GAMMIS. Here's your step-by-step instructions right here. And then the next slide will actually give you a picture version. So all you have to do is accept terms and conditions one time in order to be able to access GAHIN through GAMMIS. You log in, you select the subcategories of provider and patient profile, and then this box that's in red, agreement, the only one time, the very first time you do this, you must download each one of these terms and conditions, and actually you will have a date view when you actually have acknowledged the fact that you have accessed it. There is a date view and time will come. And the next slide, you'll have to acknowledge the fact that you have accepted the terms and the conditions. You only have to do this one time in order to be able to have continued access to GAHIN. This is a disclaimer. Once this box appears, you will exit out of GAMMIS and go straight to GAHIN. We also have a tutorial for you to review that gives you step-by-step instructions. And at this point right now, we'd like to turn it over to Amin Holmes with GAHIN to give us the detailed clinical viewer information, step-by-step, and all the great patient information you'll have access to.
Okay, awesome. Thanks, Bonnie. I appreciate it. Again, everyone, my name is Amin Holmes. I am the technical lead for the Georgia Health Information Network, and we'll be going over some of the specifics around the clinical viewer and then opening it up for questions after. So I'll try to cover all the highlights and make sure you guys get all the information you need to make the tool useful for you. Next slide. Okay, so just a high-level view of what we're going to be talking about here in this section. We're going to talk about the census search, then also looking at the patient profile, which is broken down by the dashboard, summary, the different reports, and the labs. So that's the order we're going to go in. Next slide. Okay, census search. So let's just give you an idea of what we're talking about here. So Bonnie talked about how do you actually authenticate to get into the clinical viewer. That is, after you go through that process she just mentioned, you will then be forwarded to a website. That website will land you on this page that you see here, what's called the census search. And it is exactly that. It's a search page. So think of it that way. Generally, people search by name and date of birth. That's the best way to use this. So one key question I'll already kind of address ahead of time is that you cannot do broad searches. So this has been designed to be a point of care type of tool. So the patient, you need to know the patient that you're looking for, and it's one at a time. So you can't say, give me all 30-year-old males in Fulton County. but you have to say, give me Amin Holmes on this date of birth, and that'll pull up the information for that patient. So you would want to have that information available before you begin this process. But the census search is exactly that. Put in the last name, first name, date of birth, and then you're able to click search. Next slide. Once you click search, then you have the various results that come up. 9 times out of 10, it'll be just one person. There's not many people that have the same name, date of birth, of course. However, there are some times where there may be a patient where there's some slight demographics that didn't match, and so they would show up in there twice. So that rarely happens, but it does. Most of the time, you can expect to just see the one search result like you see in this screenshot here. So in this case, we searched for Henry Demosky, and that patient was shown, and now we can double click on that patient to actually query the network for their information. Next slide. So now that I've double clicked on my search results, again, I went through the authentication that Bonnie mentioned. It took me to a website where I could put in the patient name and date of birth. I did that. It gave me search results. I double clicked on the search results, and now I can see all the clinical data that's available in GaHIN from that patient. So if you take a look at the top left, there are 5 tabs there that you'll be able to access the patient information from. So the first of those we're going to talk about is the dashboard, the dashboard tab. The dashboard tab actually is a tabular display of data that is really just geared towards people that like to see data in that way. What you'll see is a theme here is that the data is all the same. However, it just gets displayed differently. So if a person likes tabular data, they would probably like the dashboard. You have the capability of customizing this screen, so those different rectangles, sections can be moved around. They can be customized to your liking. You can also filter by the date to show just data for a certain time period. But the key thing here is that the dashboard displays the data in a tabular way, if that's what you like. Next slide. So to zero in a little bit more on the dashboard, this is an example of what I mentioned about changing the dates. So if you click in that date range area, you're able to select things like past 2 months, 3 months, 6 months. You can also select certain custom dates if you just want to pull back information related to a specific time period. Okay, next slide. Likewise, this is also an example of some of the customization. So you can make different changes to the lab results tab. You also have other functions at the bottom, such as printing. You can search through those different sections. You can expand it if that's what you want to focus on, whether it be immunizations, lab results, problems. You're able to really have a lot of flexibility with the dashboard screen. One thing I want to make sure you know as well is that you can't break it. Everything that you click on, you might make it look kind of weird, but there's always under the settings a restore function, so you can put it back just to the default view. So don't feel shy about playing around with it and getting it the way exactly you like it. Next slide. Okay, so that was the dashboard. Now we're going to talk about the summary page. So this is the same data that you saw on the dashboard, except as you can probably tell, it displays a little more graphical. It's not tabular. It's designed so that you can see the time across the top, the different years, and you can just at a glance see when there was the most activity for this patient. So in this example, you can see somewhere around 2009, 2010, there was a lot of activity: hospital visits, doctor office visits, procedures. Any of the things that we have for that patient are showing graphically here, and this allows you to zero in on a time basis. So you can go and double click on one of those and see more information. And likewise on the left side, it's also organized by different providers or different problems. Next slide. To zero in a little bit more of the legend at the bottom, so I mentioned about those little icons. So if there's a green H, that was a hospital inpatient visit. Red E, ER visit, and so forth and so on. So it gives you a chance to, at a glance, to see what the activity of this patient was over a certain period of time. And also, as I described earlier, you can hover over the different little symbols, and it'll give you more details. Okay, next slide. You can also, you have a choice to filter on the left-hand side if you just want to see data from Medicaid, if you just want to see like data from Emory. You have that option as well if you want to really just kind of zero in on specific data that you're looking for. Next slide. So so far we've talked about the dashboard, and we've also talked about the longitudinal viewer, the summary page. Here we're talking about the reports. This is what I consider the real meat and potatoes of the clinical viewer. There's the data that is presented in the previous two screens only come from our database. The reports column is all data that we have access to, can touch in any form or fashion. So it's more of a more robust place to find what you may be looking for. Because if it wasn't in the nice format to put into the database, it wouldn't show in the other tabs. Because as you can imagine, it's kind of hard. It's just not structured a certain way to put it in that tabular form or the graphical form. Here, it's more raw, but it's more complete. So what you have along the left-hand side is you have a list of every single document that's registered for that patient on the network. So the way it works in general, high level, you saw what Pam talked about, the different organizations we have connected. They're all sending in documents, clinical documents. And that may have lab information, it may have summary information, it may have immunization information, but it depends on where it's coming from. And so those documents are accessible and searchable from the Reports tab. If you're looking for an X-ray result, so you might want to go to the Reports tab and put in the word X-ray. Or if you're looking for immunization information, you might want to go and type in IM or INZ or just spell out immunization, and you will be able to search for the immunization records available on the network for that patient. Next slide. So this is an example of selecting the immunization record. You can, and that's what it looks like. If you zoom in, that top one is gray, is the immunization record that the user is trying to activate and take a look at. Next slide. And so once you've clicked on that, what happens is the network, the system goes through the network to find the actual content for that document and then pulls it over for display to you. So it's real time, comes over in a fraction of a second to display all of the information that particular member has decided to share about that patient. So for example, in this case, it would be a GRITS document that they've shared with us so that we can display it and allow you to view it via the web clinical viewer. Okay, next slide. You can also view the different CCDs. So if you click on a CCD, as shown here in this document, you'll be able to see the contents of that CCD in readable format on the right-hand side. Next slide. And that's what it looks like. So it's very similar to like the immunization one we had, but what's happening is that the content that's coming over, we are taking it and making it in a readable format with hyperlinks so that you can click on the allergy section or a lab section if it's available in the document that was shared. So one of the questions that would typically come up around this is what can you expect? What type of documents can you expect? We currently do not have we don't mandate specific fields and exact formats of particular documents. We check them for quality. You have to go through a particular quality tool before they're allowed on the network. However, we don't mandate that they include certain fields from different hospitals. So with that said, it does depend. So, for example, Emory may share something different than CHOA shares, or the GRITS document will look slightly different than something that may have come from WellStar. So the key things you would want to know is that you're interested in what happened at WellStar, you would go read that particular document. But I want to make sure you know that everyone does it a little bit differently. So not to be thrown off that if one place has a lab section and someone else didn't include a lab section, they have the right to choose what they are willing to share on the network. Okay, next slide. Okay, so this is another example of another CCD, opening the CCD and able to see the different content. So if you've used most of the web apps here, so it's pretty much like everything else. You click on what you want to see on the left, and it shows up on the right. Next slide. So this is a zoom in of what that CCD will look like on the right-hand side. As I mentioned before, you have your demographics at the top. You have your table of contents where you can then jump to the vital signs, let's say, that you want to see. And then the screen will take you right to that particular section so that you can focus on the data that you're seeking. Next slide. You also have the capability of downloading a CCD. So because of meaningful use, the certification program, all certified EHRs have to give the user the capability of importing a CCD into their system. Now, some EHRs import in different ways. I just say it that way. But they have to be able to import it. They wouldn't have been certified. So we do give you the capability of actually downloading any of the CCDs from the network. And when you download it, you're actually going to get the CCD itself, which is an XML file, but you also get the style sheet. So what that does is just you 9 times out of 10 you won't need the style sheet. That's what we use to actually make it pretty. The XML is to humans kind of like gobbledygook. You can't really make much out of it. So it's more for the machines to read. So when you download that CCD, then you can take that and import it into your EHR, and it'll know what to do with it. But so just letting you guys know that that's a capability, a function that you have access to. Next slide. Labs. So we have 2 different labs tabs. The labs that come over for a particular patient has displayed differently in this particular labs tab. You have more. It's very similar to the reports in the summary. This is much more structured. This has a lot more filtering options on the left-hand side, where you can get directly to the labs that you're interested in. If we go to the next slide, please. The lab reports is similar to what I would say is like the report tab, where it's more the raw data. And some people prefer it this way. You may want to just see it all and sort through it yourself and not have all the different filtering options and searching options on the left-hand side. You just want to see the data. So that's really what you would go to the lab report section for, that if you want to just see all of it in one place, spread out for you to peruse. Okay, next slide. And so the main thing here is we want to let you know that we do have a place that you can call if you need some help with any of these items. Again, I do want to wrap up by just kind of go over in high level what you're supposed to do. So if you have access to GAMMIS, and most of you on the call, you do have that access, you would follow the steps Bonnie laid out to actually to do all of the consent and do all of the legal paperwork piece. And then once you've done that, you can be authenticated into the web viewer that you just saw me review. And when you come in, you'll search for your patient, you'll click on that patient, and then you can go through the tabs I described to find out what works best for you. And what will happen is over time, you may log in and you'll go straight to the reports tab, or you may log in and you go straight to the summary tab because that's just where you feel comfortable. And because of your workflow, maybe the labs is where you live most of the time. But the key point is that you need to go through the GAMMIS authorization portion for it first, and then you get to access the data the way I described. So as always, we're here to help and make ourselves available for any questions.
Thank you, Amin. We appreciate the presentation. Very good. Nicely done. I'd also like to thank Pamela as well for giving us the overview of GaHIN. Our very next webinar is going to be on January 22nd. We're going to have introductions to GaHIN's new lab results program. Also, following this particular broadcast, we do have a brief survey that we're asking everyone to actually respond to. It will help us with the metrics so that we can continue to provide very good information for you. At this time, we'd like to open it up for questions. Amin, we do have one question. This could be we have two. We have one, Pamela and Amin, if you guys don't mind answering this. The question is, where can we obtain a list of all the providers in our area that are signed up for this service?
Well, I'll
go ahead, Amin.
This way.
I think we were each waiting on the other.
Yes. So the providers, it's my understanding that every Medicaid provider in the state of Georgia has access to GAMMIS. So if you have access to GAMMIS, you have access to this. So that's really, we don't provide a specific list of all those providers. However, that's kind of the rule of thumb that will help you identify who would be able to do this. So you say, do you accept Medicaid? Okay. Well, that means you have GAMMIS access some kind of way. So you should find out your password and maybe ask your practice manager how you get into GAMMIS, and then I'll go through the steps that were outlined in this presentation.
Okay, thank you. The next question is, does Care Everywhere in Epic pull data from GaHIN? Is there a difference between the two?
Oh, that's a great question. Care Everywhere, that is different than GaHIN. Care Everywhere is what links together a lot of different Epic instances. GaHIN goes across different vendors. So Care Everywhere would limit you to the other Epic facilities in your area, which may be a lot depending on where you are. But should you need information from, let's say, the VA or from public health or from GRITS or from Medicaid or from Emory, which is on Cerner, so you wouldn't be able to get that through Care Everywhere. You would need to go through GaHIN to get to that. Now, it depends on where you're coming from, which facility you're using your Epic interface with. So, for example, CHOA is a GaHIN member, and within their Epic interface, they can go to Care Everywhere, and they have a different section for that. And then they have a separate button or screen that they go to when they want to query GaHIN from within Epic. So they can do that because they have a direct connection with us. So the person asking the question, I'm not sure if you're at one of those facilities. If you are, then you would probably have a similar setup, a different tab or section for Care Everywhere, and a different tab or button or section for GaHIN or HIE type of connectivity. If your Epic instance is not connected to GaHIN in that way, then you still have the capability of using this web browser way to go in and see data as well.
Okay, thank you. We have several more questions. I'm a little confused. Do we submit claims through GAMMIS?
Not well. I'm not an expert on Medicaid. I don't know.
Yeah,
maybe Bonnie.
I don't think that's a GaHIN question for us.
I was reading it out loud, I'm sorry, and I read it before I comprehended what I was reading. For that particular question, we're going to refer you to DXC to talk to GAMMIS directly, okay? The next one is this for all patients or only Medicaid patients?
Another great question. No, it's for all patients that have visited onboarded facilities. So we work diligently to connect the whole state, but honestly, we haven't made it to every nook and cranny yet. We do have a lot of the major health systems, and probably our biggest group of patients would come from the Medicaid claims that we process, as well as the immunization records that we process. So that's probably our furthest reach of data that we have. But the more robust clinical data typically comes from the major health systems such as Wellstar, Emory, Grady, and CHOA, as well as some of the regional systems that we have, such as Gracie, which has Navicent underneath them, and Healthy Connection, Healthy Georgia, High Bridge. We have several regionals that are also bringing information into the system. So there. So the summary of your answer to your question is that it's not just Medicaid patients.
Thank you. Okay, I'm going to answer several questions. One, yes, it is covered under HIPAA. Two, you can actually access this particular handout and the slides from the GoToWebinar tool. It is uploaded in the handout section. And here's another question for everyone. Is this a good tool for an ABA provider to use when checking to see if a potential client has a diagnosis of autism?
Do you want to take that, or I can? I can.
Yeah, you could try. Go ahead.
I can start. As what Amin was just saying is that separate from GAMMIS, GAHIN is the state designated health information exchange, and we have our members who they go through an onboarding process. So, and again, to reiterate what Amin said, it's just not for Medicaid. GAHIN itself is just not for the Medicaid population, so it's for all patients. GAHIN is dependent, however, on what data is actually shared from our members. And so when you get into some of the other diagnoses that may be covered under some other state laws, behavioral health, some of those other type of diagnosis that has an additional level of consent, we're going to be very dependent upon whatever the member actually sends to us. We let the members, which is the hospitals, the providers, and the regional health information exchanges, handle that consent process directly with the patient. So in answer to your question, unless Amin has additional information, we can't say yes or no. It really is going to be dependent on what the member provides to us in terms of that information, and then how that patient consent may actually be handled. But let me turn it over to Amin, because he may have some other specific use cases or something of that nature to share.
Amin, do you have anything else to share with that particular question?
Uh-oh, did Amin drop? If you're on mute.
Okay, well, we're going to continue on. We do have another question, just making sure that this is free access. No charge is involved to use this program. Going through GAMMIS, no, there's not a charge for you to go through GAMMIS if you actually have you're a provider and who have access to GAMMIS already. The next question is a recap for the signing of the agreement for GAMMIS. We're going to pull that slide back up for you. Here is the actual summary steps, and Keep going. So right here, you actually can click on, when you log into GAMMIS, you access provider and then the subcategory of patient profile. And next slide. And then with the next slide, you have all the agreements. You have to actually put your mouse on the agreement titles and actually click each one of them. An actual PDF will appear. Once the PDF is opened, then the date viewed and time will appear on the left side of each one of the terms and the conditions agreements. And then you have to acknowledge this agreement acceptance. And from there, the disclaimer will appear. And once you hit OK, you will go straight into GaHIN. Mind you, you only have to do the terms and the conditions one time. The next time you log in, all you have to do is do the actual first few steps of provider, patient, profile, and you'll be able to hit the GaHIN link. Well, we don't have any other questions at this time. We want to thank everyone for participating in our presentation in regards to accessing GaHIN through GAMMIS. We really hope our providers are able to take advantage of it. And also, we appreciate all of the questions. If you have any other questions, by all means, you can contact the phone numbers that's in the handout. Also, please download the handout, and that way you'll have the detailed instructions. At this time, on behalf of DCH and GaHIN, we appreciate you taking the time to join us. And also, we have the survey that is going to appear when you log off. We really appreciate it if you would actually take the few moments to answer the survey questions. Everyone have a good afternoon, and thank you for joining.
Thank you.